Hello, thank you for meeting with me today to discuss employee health and safety in your workplace. My name is Bonnie Decker, and I am a public health professional with the University of New England. My role today is to provide you with an occupational health consultation. Occupational health is the identification and control of risks arising from physical, chemical, and other workplace hazards in order to establish and maintain a safe and healthy working environment. Your investment in occupational health in your workplace gives credit to you as an employer. The benefits of this type of consultation include a safer workplace environment, improved employee satisfaction, a more attractive workplace culture, and lower insurance rates for your business. I'd like to start by saying how impressed I am with how much you already support your employees. Your employees clearly enjoy many aspects of their work, and the existing adaptive equipment, such as modifiable standing desks, put you ahead of the game. Your mod rate of 0.75 further demonstrates your track record of caring for your employees. That being said, there's always room for improvement, and I'm here to support you in making your workplace as safe as possible. In this presentation, we'll discuss the hazards identified in the office workplace and why those hazards pose a risk to employees. Then we'll review my recommendations to mitigate these risks in the future. After that, we'll make sure to leave time for your questions and exploring your options. I'm excited to share my findings with you, so let's get started. First and foremost, we noticed repetitive motion tasks as a major hazard in this workplace. Employees are spending approximately 5 hours a day keyboarding and utilizing a mouse. That can set them up for carpal tunnel syndrome and other issues. This is relevant as we've had 3 recent cases of carpal tunnel syndrome within the last 10 years. Secondly, we observed potential ergonomic hazards. Although you have adaptive equipment in place and employees can sit or stand, there was no evidence of formal training on use, and several employees were not demonstrating good ergonomics. This can lead to musculoskeletal strain. Additionally noted were the risks for visual strain. The room had sufficient lumens to meet OSHA guidelines, but employees were noted to have glare and backlight from windows. This can induce eye strain and headaches. There was a report of mold in the bathroom, which is a known respiratory irritant and can exacerbate allergic responses. We were initially consulted because of complaints of drafts and temperature changes. The HVAC system has not had a full assessment recently, and it would need one to assess for flow and function before we can really provide recommendations. Employees also reported that there was frequently fluctuations in temperature that made it difficult for them to thermoregulate or to be able to maintain their own temperature. When we were there, it was noted that the temperature was higher than the industry recommendation of 68 to 76 degrees Fahrenheit. However, employees were noted to have gloves and blankets at their desks. These wide variations and fluctuations in temperature may affect worker productivity. We performed in-depth analysis of the psychological stressors of this job by utilizing a job control demand matrix. Employees performed well in the areas of skill discretion, decisional authority, decisional latitude or control, but their psychological demands were below average, suggesting that some employees may be performing suboptimally and would benefit from more challenge in their environment. We did not observe a disaster plan during our visit, and somewhat related, we also observed cluttered walkways between the desks. These prevent trip hazards and also prevent egress in the event of an emergency. To ensure safety, we would first and foremost recommend a safety committee for all types of workplaces. These committees last for much longer periods of time than your initial consultation and can review new safety hazards on an up-and-coming basis. Many workplaces have an incident reporting system, but we'd recommend that yours include a near-miss option so that employees can report unsafe conditions even when an injury doesn't occur, and this can help prevent those same injuries from happening in the future. I'd like to move on to my other recommendations. So, for repetitive motion tasks, which I would view as one of your biggest threats, educate employees about their risk. Use adaptive devices like dictation machines and enforce breaks. This isn't currently happening, but evidence has shown that this can mitigate the risk of carpal tunnel syndrome. To prevent ergonomic hazards and visual strains, our strongest recommendation would be for a tailored consultation for each employee to ensure that their workplace fits them. Educational materials and posters will also be helpful to help employees be invested in their own health. Reports of mold can be mitigated by removal by the janitorial staff immediately, and the bathroom should be checked for leaks and ensured that humidity is in appropriate levels. Again, the HVAC system needs to be assessed for flow and function before further suggestions can occur. and the temperature should be kept to the industry regulation of 68 to 76 degrees Fahrenheit. For psychological strain, train managers to acknowledge and recognize any mental health concerns. Utilize your workplace employee assistance program, which addresses mental health issues, and provide a balance of challenge and ability for employees. All staff should also receive a mental health training that covers topics such as suicide prevention. For disaster preparedness and fall risk, reduce obstacles and walkways to promote safe egress, and develop a disaster plan such as those offered by FEMA. Workplace injuries follow systematic patterns that can be reduced through targeted safety interventions. Investing in occupational health reduces the likelihood of expensive workplace injuries. Many of the interventions that we have to offer are low cost and easy to implement, and I look forward to partnering with you to make your workplace as safe as possible. I'll gladly take your questions now.